Hi there, this is Mike Latosky with Discovery Benefit Solutions, and welcome to the Genesis Healthcare Employee Benefit presentation for MSO employees, effective January 1, 2014. In this presentation, we've got a packed agenda. We're going to cover basically all aspects of the Genesis Healthcare Benefit Program and wind up with some information on how to enroll in benefits and who to call with questions. So throughout the presentation, we'll be hitting the highlights of each agenda item and explaining each benefit to you. And at the end of the presentation, we'll walk you through how to enroll and if you have questions, who to call. So with that, let's move forward. First question is, who's eligible for this program? MSO full-time employees working 30 hours per week, spouses or domestic partners, and children up to the age 26, regardless of student, marital, or dependent status, are all eligible for this benefit program. The network we're going to use is the Cigna PPO network. It's one of the largest PPO networks in the U.S. You'll have access to doctors and hospitals on a nationwide program through Cigna, nationwide basis through Cigna. You'll have no primary care physician required, so you won't have to sign up for a primary care physician, and you'll have direct access to all specialists. Once again, this is the network that we'll be using for both the EPO and HSA plans, which we're going to get into next. How do you find a doctor or hospital with Cigna? Go to the Cigna website at cigna.com, click on Find a Doctor, click on the doctor or hospital you're interested in, then select Search Type. An example would be searching by provider name, address, city, state, or zip code. And what you want to do is make sure once you've gone through those steps that your provider or hospital of choice is actually contracted with Cigna's PPO network. Cigna has a number of different plans, networks that they offer, and what we're looking for is that your chosen provider, doctor, or hospital is contracted with the PPO, Cigna's PPO network, which will be on the drop-down menu that's provided. Who administers our medical plan? We've hired HealthScope Benefits to be our third-party administrator. HealthScope can answer any questions for you about your plan, help you with claims, order ID cards, check eligibility, and find providers, and much more. You can reach customer service at HealthScope Benefits from Monday through Friday from 7:30 a.m. to 4:30 p.m. Pacific Standard Time at the number provided. You can also check out HealthScope's website and check eligibility, order ID cards, and much more via the website. So let's get into the benefits. The EPO medical plan highlights, and EPO stands for Exclusive Provider Organization. Essentially what that means is this is a PPO plan with no out-of-network benefits. So we're going to ask you that you stay within the Cigna network. And as long as you do so, you're going to have no deductible. Preventative care is going to be covered at 100%. For Genesis imaging locations, you're actually going to realize some reduced copays, and we've got more information that we'll be handing to you on how that works. Doctor visits are going to be covered for a $25 copay. Going to urgent care is going to cost you a $50 copay. Emergency room care is going to be a $250 copay, but that copay will be waived if you're actually admitted to the hospital. Hospitalization will be covered for a $1,000 copay per admission, and your out-of-pocket maximum, which is the maximum amount you're going to pull out of your pocket for those hospital copays, whether it's outpatient or inpatient, is going to be limited to $3,000 for a single and $6,000 for a family. Once you've paid that amount out of your pocket within the year, then the plan will pay 100% thereafter. And this plan has an unlimited lifetime maximum benefit. So that's the EPO plan highlights. Let's talk about the HSA or Health Savings Account plan highlights. With this plan, Genesis Healthcare is going to contribute $100 a month to your HSA account, and we'll have some information on setting up that account in a moment here. With the plan benefits, you're going to have a deductible of $3,000 per person, or $6,000 per family. Preventative care is going to be covered at 100%, not subject to the deductible. Doctor visits are subject to deductible, and then the coverage will be you would pay 20% of the cost as long as you see a network, a Cigna network or in-network provider. If you go out of network, the coverage will be reduced to 50%. For emergency room coverage, Once again, after you pay that $3,000 deductible, you would pay 20% of the cost in or out of network. For hospitalization, once again, you'd pay your deductible first, and then the plan you'd pay 20% in network at in network providers and 50% at an out of network provider. The out of pocket maximum in network for this plan is $5,000 for a single, $10,000 for a family, and the out of pocket maximum out of network will be $10,000 for a single and $20,000 for a family. Want to share a little information on health savings account, or what we call HSAs. Some of the advantages of an HSA plan are that it's a health savings account where you can set aside money on a federal pre-tax basis to help you pay for healthcare expenses and meet deductibles. So the pre-tax ability to pay for healthcare expenses on a pre-tax basis is a pretty significant advantage of HSA plans. Another advantage is that any unused balance that you have in your health savings account gets carried over from year to year, and you can take the account balance with you if you ever leave the company. So it's portable. So we see that as another significant advantage of an HSA plan. In 2014, the Internal Revenue Service has limited HSA contributions to $3,300 for a single and $6,550 for a family. And that's in total. So with this plan, if you were to enroll, as we said earlier, Genesis Healthcare would be contributing $100 a month, $1,200 a year towards into your account. You would be able to set aside the balance up to the $3,300 or $6,550 yourself on an annual basis. For more information on a health savings account, you can go to the IRS website, or we encourage you to consult a tax professional. Let's talk about the prescription benefit for the EPO, or exclusive provider organization plan. The prescription benefit for this plan is going to be for a 30-day supply. You're going to pay a $10 copay for generic drugs, $25 copay for brand name drugs, and a $60 copay for non-formulary brand name drugs. These are brand name drugs that are not on the formulary and tend to be very expensive, so that's why you're going to pay that $60 versus the $25. We have a 90-day mail order program available that saves you a lot of money. You can get a 90-day supply by accessing the mail order program for 2 copays, so it saves you a copay every 90 days for your maintenance medication. We also have a convenience item called Retail 90, which allows you to pick up a 3-month supply of your maintenance medication at a retail pharmacy for 3 copays. Specialty drugs are also covered at 30% up to $100 maximum per prescription. And the pharmacy benefit at Genesis Healthcare is delivered by Welldyne RX, and you can see the website there. We encourage you to go to their website for any questions you may have. For the HSA plan, we've got the same prescription company, Welldyne RX, managing this plan. Your copays are for a 30-day supply after the deductible is met once again. So that $3,000 deductible per individual and $6,000 per family would be paid first. Then you get a 30-day supply of your generic medications for a $10 copay, $25 copay for brand name drugs, same $60 copay for non-formulary brand name drugs, and then you have the same mail order and Retail 90 benefits available to you for your maintenance medications, and specialty drugs are covered at 30% as well, up to $100 max per prescription. So whether you're on the HSA or EPO plan, your benefit is delivered by Welldyne RX. Also wanted to let you know that there is an option of a cash in lieu program that you can take advantage of. If you're declining the Genesis Healthcare Company benefits and have other group coverage, Genesis Healthcare Partners will give you $100 a month as cash in lieu. Other group coverage does not include TRICARE, Medicare, or individual health insurance policies. So to be eligible for the cash in lieu program, you must have coverage available through, say, a spouse, enroll in that coverage and prove that you have enrolled in that coverage to Human Resources, and that cash in lieu payment of $100 a month will be available to you. Please see Human Resources for the cash in lieu form if you're interested in enrolling in this program. So let's talk about your dental options. You've got 2 dental options to choose from, both with United Concordia. You've got a DHMO plan or a PPO plan, and we're going to get into some of the benefits of both programs here. With the DHMO program from United Concordia, you're going to have affordable employee premiums. You're not going to have any deductibles or plan maximums to worry about. You'll have fixed co-pays for all the procedures that are covered, but you must select a primary care dentist with this program. So in signing up for the DHMO program, you would select a primary care dentist or dental group from the list that's available, and then go to receive all your dental care at that group. You can change on a monthly basis, so if you don't like that dental group, you can switch to another as long as they're contracted with United Concordia. But as long as you're enrolled in a DHMO plan, you would need to go to that selected primary care dentist for all of your care. Examples of some of the copays for an offices or cleaning: you would have no copay. Porcelain crown about midway down would cost you $110 copay. Orthodontics are covered for a $1,500 copay for a child orthodontics or $2,000 for adult. The PPO plan works a little differently. You're not going to be signing up for a dentist, but you're going to have an in-network benefit and out-of-network benefit. If you find a United Concordia dentist that you're happy with, that's the best way to go, because your money's going to go a little further. Those services with that PPO dentist with United Concordia are all going to be discounted, and it's going to make your dental money go further, if you will. In-network and out-of-network, we have the same benefits. So the real difference between the in-network and out-of-network is that discount you get and the power of that discount if you go and see United Concordia PPO dentist. Whether you're in or out of network, you're going to have an annual deductible that's waived for preventative care of $50 for a single or $150 for a family. Your annual maximum, which is the maximum amount of money you have to use on an annual basis for dental care, is $1,000 per person, whether you're in or out of network, and excludes any charges towards preventative care. Preventative services are covered at 100%. No deductible applies whether you're in or out of network. That would be your annual teeth cleanings and such. Basic services are covered at 80% after the deductible. Example of basic services might be a cavity filled or something like that. 80% in and out of network. Major services are covered at 50% after the deductible, whether you're in or out of network. Example of a major services would be a crown or maybe a bridge. We do have a waiting period for major services on the plan, but we do give you credit for prior coverage. So if you have prior coverage that you've been on continuously, that waiting period is waived, and you have the ability to day one receive major services. Orthodontia is covered on this plan. It's got a separate lifetime maximum that covers 50% of the cost of orthodontia up to $1,000 for lifetime. Whether you're in or out of network, you have the same benefit there. And you are subject to a similar waiting period. It's 12 months instead of 6 months for major services. But once again, credit is given for prior coverage. So if you're on a plan coming into the Genesis plan, will waive that waiting period, and you have that benefit immediately available to you. United Concordia has a great website at www.ucci.com where you can print forms, print ID cards, and much more. They also have customer service available. For DHMO, we provided the number and PPO there, and we encourage you to access their website or call their customer service folks if you have any questions about their programs. Now, the vision plan at Genesis Healthcare is delivered by VSP. You've got an in and out of network benefit. As with the PPO dental program, the way to maximize your dollars and save as much money as possible on vision care is to stay in network. If you do in network for an eye exam, if you stay in network for an eye exam, you're going to pay a $10 copay. Out of network, you can see you receive a reimbursement of up to $45, so much better deal to stay in network. For single, bifocal, or trifocal lenses, coverage is going to be 100%, and you can see the grading of the amounts that are available to you if you go out of network for those same lenses. The frames in network, you've got a $130 allowance. You've only got up to $70 for frames if you go to a non-VSP provider. Contacts, same thing, $130 allowance, and up to in network, up to $105 out of network. And then exams are covered every 12 months. Your frames are covered every 24 months. And then lenses and contacts are also covered every 12 months. Do want to mention as well, you do have a material copay of $25 for glasses. So you'd pay that $25 copay, and then your lenses would all be covered 100%, and you'd have that $130 in-network allowance for frames. Any questions about the vision benefit, you can go to vsp.com or call the 800 number provided there at the bottom of the screen. Next, we're going to talk about the group life and accidental death and dismemberment insurance that's provided by the Hartford to all Genesis Healthcare employees. Through Hartford, you'll receive a $50,000 life and AD&D benefit. The premiums are paid 100% by Genesis Healthcare, and additional life insurance can be purchased through the Hartford by employees, spouses, domestic partners, and children. The additional life insurance coverage offers you the ability to purchase an additional 100K, up to 100K, $100,000 of guaranteed issue life insurance if you apply for that insurance when you're first eligible for the program. Guaranteed issue means there's no underwriting, so you're just guaranteed up to $100,000 of life insurance with no underwriting. More can be purchased with a simplified underwriting form, and Human Resources has more information on that for you. Next, we're going to talk about the long-term disability program, also delivered by the Hartford. Premiums for this program are also paid by Genesis Healthcare Partners. This program covers you if you're hurt or become sick away from work, and the benefit has an elimination period of 360 days. So after 360 days from being deemed disabled by your doctor, the benefit would start paying. It would pay 50% of your monthly earnings to a max of $3,000 per month. There's also additional coverage that may be available via what's called the Progressive Illness Rider. That's part of the program. Some value-added benefits offered through Hartford for the life and disability enrollees. You've got travel assistance program, ID theft resolution program, beneficiary assist counseling services. You also have what's called an ability assist EAP program, and all these programs are value added. More information on them can be found at hartfordlifeconversations.com. We do have a standalone employee assistance plan that's available through Aetna for all employees. This program offers 8 face-to-face confidential sessions per employee and household member per issue per year. So examples of some of the issues you may want to set up an appointment and talk about with the professionals at the Aetna Employee Assistance Program are marriage and family conflicts, substance abuse, financial and legal services, and stress management, just to name a few. They have an online concierge service, some wellness health assessment tools. They have a 24/7 crisis hotline, and a great website that's provided through horizoncarelink.com with the user ID and password provided. So we encourage you, if you're having any of these issues, to consider calling the folks at Aetna and the Employee Assistance Program for help with those issues. Next, we're going to cover the flexible spending account. Flexible spending account is administered by Discovery Benefits, and with this program, you can set aside up to $2,500 pre-tax through payroll deductions to pay for medical, dental, and vision expenses not covered by the plan. Examples of those expenses would be copays and coinsurance and so on. You can go to discoverybenefits.com or to Genesis intranet for a list of eligible expenses. A couple convenience items are included. You've got a debit card that any amount you set aside up to the $2,500 will be loaded on that debit card, and you can pay for all of your office visit copays or what have you with that debit card. You also have the convenience of direct deposit, which is great. There's a dependent care reimbursement program, which is the second part of the flexible spending account, which allows you, if you have children in a qualified daycare setting, you can set aside up to $5,000 per year on a pre-tax basis to pay for that daycare. We want to remind you that the Internal Revenue Service use it or lose it provision applies, which means that any money you do not use in the plan year, you set aside and do not use in the plan year, is lost. So we would encourage you when looking at either the healthcare or dependent care programs to be conservative when planning. If you're rolling in a health savings account, you are eligible to participate in what's called a limited purpose FSA plan for dental and vision. This is a new notice for 2014. We want to notify you that healthcare exchanges are available. Covered California's California's new health insurance exchange, where individuals, families, and small businesses can find affordable health insurance. The plans have different levels of coverage: platinum, gold, silver, and bronze, and they have no medical underwriting. Open enrollment started in October of 2013 and goes through March of 2014, with the first effective date being January 1st of 2014. Well, we wanted to make sure you understood that as a Genesis Healthcare employee, that you are not eligible for any healthcare subsidy on these plans. So while you can go to Covered California and purchase your healthcare, you would not be eligible for a subsidy of any kind, being that you're eligible for Genesis Healthcare's plan. For more information, please go to coveredcaliforniaca.com or call the 800 number provided at the bottom of the page. So let's talk about your pre-tax medical contributions for the EPO and HSA plans. These are the contributions that will run from January 1, 2014 to December 31st, 2014, and they're per paycheck contributions. For employee only, for the EPO or HSA plan, there is no contribution. For employee plus spouse or domestic partner, for the EPO plan, you would pay $144.60 per paycheck, or $67.80 for the HSA plan. For employee plus children, you would pay $105.20 for the EPO plan, and then $39.33 for the HSA plan. And for employee plus family, you would pay $263 per paycheck for the EPO plan, and $153.22 for the HSA plan. Next, let's look at the dental and vision contributions for January through December 2014. These are once again per paycheck. For employee only, for the dental PPO plan, you would pay $22.28 per paycheck, $8.49 for DHMO, and then $4.16 for the VSP Vision program. Employee plus spouse or domestic partner would pay $45.35 for the PPO plan, $16.98 for DHMO, and $7.12 for VSP Vision. Employee plus children would pay $49.49 per paycheck for the PPO, $17.23 for the DHMO, and $7.27 for the VSP Vision. Then employee plus family runs $82.97 per paycheck for PPO, $25.75 for DHMO, and $11.72 for the VSP Vision program. Now, what do you need to do to enroll in the benefit program at Genesis Healthcare? Number one, you need to complete the universal enrollment form that will be provided to you for the Cigna medical plans, United Korea dental plans, and VSP Vision plan. Health savings account enrollees must also complete additional paperwork to set up the health savings account with a third-party vendor. You must complete the cash in lieu form if you're declining benefits or interested in accessing, taking advantage of that program. And we ask that you return completed forms to Human Resources within 31 days of the date you are eligible for benefits. Please see Human Resources for any forms, or the company internet site also has those forms available. And then also, we'd like to ask you to please notify Human Resources of any life event changes during the plan year within 31 days of the event change. Examples of event changes that we want notification from you would be a marriage, a divorce, or the birth of a child. That's the end of our presentation. Thank you for listening. Once again, I'm Mike Latoski with Discovery Benefit Solutions. And if you have any questions going forward, please call Carla Gibbons at Discovery Benefit Solutions at 619-704-3519, or you can email Carla at carlag@discoverybenefitsolutions.com. Thank you for your time.